In today's class, we are going to discuss one particular topic in cardiac equipment, that is cardiac ablation catheter. So the cardiac ablation is one kind of procedure which is used to destroy the heart cells, that is the damaged heart cells, which is the reason for producing abnormal arrhythmias. Okay, so let's have a discussion on this particular topic, that is what is all about cardiac ablation and cardiac ablation catheter, how does it works. So first we will see the introduction of what is cardiac ablation catheter. So the cardiac ablation catheter, here we are using the tool which is nothing but catheter to destroy the particular damaged heart cells. So that catheter, as already we know that it is a flexible tube. It is hair like thickness, which can, so that it can be easily navigated inside our blood vessels to target the area where you want to focus, right? So this flexible tube is actually used to treat the abnormal arrhythmias, because this flexible tube, it has the attachment of two things. One is electrode, another one is to deliver the energy. Right? The electrode will sense the targeted area about to see what is the functionality of that area to ensure whether we are reaching the corrected targeted area or not. By mapping those electrical activity and visualizing the electrical activity outside, once it's been confirmed, the same catheter having the option of delivering the energy in order to break or destroy the particular cells or tissues which you want to damage. Okay, so this is all about like cardiac ablation catheter. How does it works in the sense, first it is map doing the functionality called mapping, second one is ablation. As I said before, the catheter, once you are navigated through the blood vessels by making small incision, or you can send it through groin, that is the part in the thigh. So once you inserted, first we will do the mapping. That it means that we have to identify the targeted area correctly. Then only we can go with the next process, that is called ablation. So for identifying the targeted area, we will do the mapping where you have the component called electrodes in the catheter. That electrode will sense the electrical activity of that particular cells. If we see that electrical activity, it is not in proper, it's abnormal in the sense that is the actual area where we want to focus. In this way we will do map with the help of electrode which is present in the catheter. Second, once the location, the target area has been identified and located with the help of electrodes which is there in catheter. Second process we will go with ablation. So ablation, you know already, it is mean by destroying. So in this process, the same catheter, it's have a option of delivering the energy. Through the catheter we will be delivering the targeted energy, the amount or quantification, how much we need to destroy. Once it's been centered, the abnormal tissue will will get damaged, or we can easily isolate it from other normal tissue. So in this way, in this process, we can easily remove the cells which is the responsible for abnormal arrhythmias, so that other neighbor cells will not be affected. At least moreover we will recover the normal, I mean, we will recover the functionality of heart, that is a normal rhythm. So this is the overall overview of what is mean by cardiac ablation catheter and how does it works. So next we will see the types of ablation. Yes, the types of ablation means, as we know that anyway we are going to damage the cells, but how we are going to damage the cells means by passing the some sort of energy. So based on the energy we applied, we have different types of ablation. One is radio frequency ablation, second one is cryoablation, and third one is laser ablation, and fourth one is pulsed field ablation. So in radio frequency ablation, it is following the principle called the heat energy. So here we will send the radio frequency waves which will dissipate the heat. Once it interacted with tissue, that heat will destroy the abnormal tissue. So mostly we can see this type of technique for treating the atrial fibrillation and supraventricular tachycardia. And the second one is cryoablation. The cryoablation is nothing but here we are using the temperature, energy as a cold energy. That is, we are making the cells to be freeze. Okay, by keeping that tissue at very low temperature. For example, by passing any nitrogen gas or something, we are freezing that area so that once the cell it's been freezed, it will not generate any action potential. So in this way we are isolating the abnormal cells from the normal cells. So where we can use this type of particular technique is when you want to treat like any atrial fibrillation treatment. So for that we have to first isolate the pulmonary vein for proceeding the atrial fibrillation treatment. So in that case we can go with cryoablation. Third one is laser ablation. So laser ablation, we will sending the laser energy to treat the tissue. So when we have to use this particular laser ablation, in the sense when the precision is needed very much high, in that case we can go with laser ablation. Because the radio frequency or cryoablations, there are chance for the neighbor cells or tissue be involved in the whole process, or it will also get interfere. So if you need a very more if you want to do some kind of treatment in the tissue which is more complicated without affecting neighbor tissues, if you want to do more precisely, in the sense, then in that case we can go with the laser ablation. The last type is pulse field ablation. In short form we call the PFA catheters. So here we will be using the non-thermal. That is, here no way we are going to use heat energy. So this is called non-thermal type high voltage electric pulse energy is being used. Okay. So here to be simple, we are going to send the electric pulse, that is with some periodical waves to ablate the selective tissue. So that is the reason that particular type name is called pulse field ablation catheters. So here also we will have very minimized damage to the surrounding structures like nerves and blood vessels. So these are four major different types of ablation. These classification is especially based on the type of energy what we are using. Yeah, next one is the common problems during the procedure. What we can usually we will have when during this particular thing is these are the few things that we have listed here. That is a damage to healthy tissue. That is when you are focusing focusing the abnormal case, abnormal cell or tissue, there are chances for the neighbor normal tissue to get affected. So that is the reason we have the one kind of common problems for this ablation procedure, that is a damage to the healthy tissue. Example, heart block. And then second one is blood vessels injury. So when you are treating any particular cell or tissue, obviously there will be some innervated blood vessel nerves you can see. So when you are treating that damaged cells, that part blood vessels and nerves will also get affected. So the injury will cause in that particular blood vessel. So as a result, we will have some side effects. So that's why it has been considered as the second common problems during this procedure. And third one is cardiac perforation or tamponade. This is like puncturing of a heart wall. This is like again you have some abnormalities in the mechanism of perforation. So it's been affected because of this procedure. And last one is blood clots or stroke risk. Okay. So these are the few common problems you can mostly see when you are performing ablation procedure. So that's all about today's topic. Like, just we had an introduction about what is all about cardiac ablation procedure and what is the main mechanism or principle which is behind in this particular technique. What is the main tool which is highly needed to do this or to carry out this ablation procedure, which is nothing but catheter, right? And then followed by we had a discussion of different types of ablation and the common problems we can see or found when we are performing this procedure. So in next class we will come up with the next interesting topic, and thank you.